what happened to me after I initially recovered from COVID-19 is that I thought I was good. You know, I had my 10 days of symptoms and recovery. I was back at work, back on track. And then about maybe 10 to 14 days later, I felt 2 of my symptoms return. The fatigue, the extreme fatigue, and chest pressure. And so I was very surprised and a little scared. And I reached out to my doctor, who is actually a doctor at Montefiore Health System. And she was wonderful. She was amazing. And she called me and explained that, you know, our doctors are learning about this virus every day, every week. And she shared with me that one of the new things that they had learned was that for a certain subgroup of individuals, the symptoms would abate, and then maybe a week or 2 weeks later, some of the symptoms were returning. And she explained to me that that did not mean that I was still infectious and could possibly contaminate others, because that was one of my concerns. I didn't want to get other people ill. And but that she recommended I really needed more rest because she knows how much I work and how much I love my work. And so she also ordered some tests for me, you know, just to kind of rule out any heart issues. And those tests, I was able to get them done. They were negative, thank goodness. And I got more rest. And then the symptoms went away again. So that was my journey in terms of my recovery. And so at this point, I think we're in May, and it's been probably 6 weeks since I initially started to show symptoms. And I'm happy to report that I have not had any symptoms come back, and I feel good physically, emotionally, spiritually.